ask your question in the chat box by sending it to the person whose name is Ask a Question. If you joined by telephone, please email your question to orcovid19.jic@dhsoha.state.or.us. Let me say that one more time. Email your question to orcovid19.jic@dhsoha.state.or.us. And again, we'll try to get to all the questions tonight, but at the end of the presentation, we'll have contact information at the end of the presentation so that you know how to reach people. First, let me just make a couple of quick comments. The Oregon Health Authority is concerned about the health and well-being of workers at Pacific Seafood in Warrenton who may have been exposed to COVID-19. Food processing establishments, including seafood processors, have been severely impacted by COVID-19. What's more, many people who work in these facilities identify as Latino, Latina, or Latinx, who are among the groups that have been disproportionately impacted by the virus. The health authority has determined that these workplaces, their workers, and their products do not pose a significant risk to the public. Workers of a business with a workplace outbreak should never be subjected to discrimination or excluded from patronizing other businesses. OHA has been working closely with Pacific Seafood in its response to 2 outbreaks at the company's food processing site in Warrenton since this summer. The company's been cooperating fully with the state, which helps investigators and contact tracers identify new cases and their close contacts, get them isolated and quarantined, and prevent further spread of the virus. It's also important to know that outbreaks like this are complicated. And as you'll hear a little bit later, they can involve things like social events, people who have contact with other members of their household, as well as employment. And so all of these things can work together to cause the number of cases to build up. And it's not so simple to just point to a particular event or a particular place and say that was the cause of the outbreak. And that's certainly the circumstance here. We're actively doing outreach to the Latinx community in Clatsop County, including contracting with community-based organizations to provide contact tracing and resource navigation in Spanish. We've had a Facebook Live session in English and Spanish, and we've been doing radio broadcasts in Spanish to try to get good information out. Any sudden increases in cases can affect a county's presence on the watch list. We've added Clatsop County to the watch list based on the number of cases that couldn't be traced to another case. We're continuing to gather information and make determinations on watch list status, and we do that on Thursday of each week based on information from the week prior. OHA works closely with Clatsop County, which as the local public health authority is the lead agency responsible for responding to public emergencies like this. We've collaborated to complete contact tracing and case investigation. OHA does not always provide on-the-ground assistance, but steps in to support a county's request, which occurred in this case. The Oregon Department of Agriculture is the state agency responsible for regulating food processing plants like Pacific Seafood and works closely with employers to assure safe practices. And Oregon Occupational Safety and Health Administration sets workplace standards and responds to complaints regarding worker safety. I'm now going to turn things over to a handful of speakers who are going to briefly provide some information, and then we'll open it up to your questions. So first, let me turn to Dr. Emilio DeBess from the Oregon Health Authority to talk about community health and infection control. Dr. DeBess.
Thank you, Pat. Could I have the slides, please? Y para aquellas personas que quieran entender la interpretación en español, por favor vayan a su pantalla. Abajo tienen un icon que es de un mundo, se llama interpretación. Ahí haga un clic al Spanish. Puede oír la interpretación en español. Good afternoon, everybody. My name is Emilio DeBess. I'm one of the senior health advisors here at the Oregon Health Authority. Thank you all for having us. Next. So I wanted to talk briefly about the Pacific seafood outbreak in Warrenton. A cluster of cases was identified, mostly following one before that. Was identified. Let me go back one more. Thank you. Was identified following a Labor Day gathering. The staff at Pacific Seafood were tested somewhere between 9/22 and 9/25 to identify additional cases related to COVID-19. During that testing period, 87 staff members tested positive. 83 of them were Clatsop County residents. Again, that's preliminary early information out of the two testing events that took place between 9/22 and 9/25. Next. So the timeline that we wanted to share with you is on 9/22, 159 employees were tested, and 81 of them were positive for COVID-19. That was the last day the staff worked the night shift. Then and based on the findings during that testing event, Pacific Seafood decided to test the day staff, at which time on the 24th and 25th, 106 employees were tested, and out of those, 6 were positive for COVID-19. On 9/24, Pacific Seafood closed voluntarily. During that same time, on 9/24 and 9/25, OHA and Clatsop County Health Department conducted case investigation on all cases, including those of the original cluster. So isolation and quarantine began at that point. On 9/30, Pacific Seafood opened their operations on a limited status based on the staff that had either tested negative or had no contacts to the positive staff at the facility. Next. So here's what we know. COVID-19 is a community-acquired infection. I think most of us have learned that it's not only a concern for Pacific Seafood, but it's also a concern in Clatsop County, throughout the state of Oregon, throughout the United States, and throughout the world. But there are no any single pockets out there that do not have any cases of COVID-19. Again, it's a community-acquired infection. Household transmission plays a huge role in the transmission of disease, and we have to be very aware and very careful about how transmission does happen, and definitely households are of a concern. The initial cluster that we identified was related to a Labor Day gathering, not associated with Pacific Sea. Next. So what we don't know is whether the Labor Day gathering actually contributed significantly to the increase in the number of cases. As I said before, and as Pat mentioned, there are multiple factors that complicate an investigation. There's a long incubation period of 14 days in which people could have been exposed at any time during that period. And that makes it a little bit more difficult to pinpoint the source of infection. Transmission could also have occurred in other places outside of work, such as restaurants, bars, anywhere else outside of the household that could have also allowed for this. So we have to think a little bit more globally in that respect and the potential for transmission. And then what we don't know if there will be more cases related after isolation and quarantine. Our assumption will be that yes, household cases will be identified, and yes, that some other community cases or even cases within Pacific Seafood will be identified as well. Next. So steps moving forward is really kind of what we're all about here. We want to make sure that we continue to provide the technical assistance that is needed. We want to make sure that we worked with a wonderful community-based organizations that have helped a lot of people within the community, including people in this outbreak, and providing the services that they need, such as wraparound services that are so important to maintain those individuals under quarantine and isolation. We will continue to test those that are symptomatic, staff that is symptomatic, just to make sure that we understand the spread of the disease or COVID-19. And also, the last but probably one of the most important things is to educate our community and minimize the spread of COVID-19 not only in Clatsop County, but within the state of Oregon. Next. Thank you.
All right, thank you, Dr. DeBest. Next, I'd like to turn to Monica Steele with Clatsop County. Monica?
Thank you. Monica Steele, Assistant County Manager, Clatsop County. So over the last 7 months, Clatsop County has had to learn and adjust to the many nuances of a pandemic. There are challenges and risks that are ever present, regardless of our desire and hope for a return to normal. The hard truth is the virus is with us and it will be with us for the foreseeable future. To maintain any semblance of normal, the county has had to and will continue to encourage our residents and those who recreate in our county to do our part to wear masks in public, maintain social distance, and limit large gatherings, as well as practice proper hygiene. The county has and will continue to actively partner with federal, state, and local government agencies, in addition to local businesses, schools, faith-based organizations, and community members to effectively and efficiently respond to outbreaks within the county. During a pandemic, we do not have the luxury of going it alone or acting unilaterally. We need to coordinate and bind our efforts in a way that minimizes the spread of a potentially deadly virus and protects the vulnerable and simultaneously supports businesses. From the onset of the pandemic, the Clatsop County Public Health Department, in partnership with OHA, has made a concerted effort to provide community outreach and education on how best to protect our community members in an effort to prevent the spread of the virus. The Public Health Department has provided testing, contact tracing, quarantine housing when necessary, and in partnership with our community-based organizations, provides wraparound services to those in quarantine. The Clatsop County Emergency Management Office has worked with our first responders as well as other community partners to distribute PPE and coordinate regular communications. In addition, the Board of Commissioners approved funding to support our community partners in an effort to provide additional resources for those most impacted by the closure of our economy within the county. As previously mentioned, this virus will be with us for the foreseeable future, and it's important that we all work together as a community to continue to do our collective best to help keep one another healthy and safe during these unprecedented public health times. The Board of Commissioners, along with county management, will continue to work cooperatively with all of our federal, state, city, and community partners to try and take a proactive and collaborative approach when addressing the ongoing challenges this pandemic has brought our community, both from a health and an economic perspective. Thanks, Pat.
Great, thank you, Monica. Now I'd like to turn to Viviana Matthews and Susan Prettyman from Clatsop Community Action Team.
Hi, everybody. I'm Viviana Matthews, the Executive Director at Clatsop Community Action, which helps people meet housing, food, and other basic needs. CCA received a contract from OHA to provide education, outreach, wraparound services such as food to people who have been affected by COVID-19 in Clatsop County. CCA has been working very hard to provide all the services that workers from Pacific Seafood might be needing under the quarantine times. Next, Susan from CCA will be giving details on how CCA has been assisting Pacific seafood workers while they're under quarantine due to COVID-19. Susan?
Thank you. I'm Susan Prettyman. I'm the Social Services Program Manager at Clatsop Community Action. I want to just briefly let everyone know what our direct services team at CCA has been doing to support quarantine members within our community. So first, we receive a referral from the local public health department with information about the client who's been quarantined or isolated. And then we discreetly contact that client and we offer wraparound services such as food, hot meals, energy assistance, and even rental assistance if they need some extra support. In regards to the workers under quarantine from Pacific Seafood, we've partnered with several different local restaurants and agencies to provide wraparound services and supports. We have a team of staff that assess the workers' needs. They shop, order food, assemble, and then safely deliver the food to the workers. And to date, CCA has provided close to 1,000 warm meals for Pacific Seafood workers. I urge anyone in the community that has been negatively impacted by COVID-19 to please contact us at 503-325-1400 for more information. Thank you.
Great, thank you. Last, I'd like to turn to Brandy Hogg from Pacific Seafood. Brandy?
Hi everyone, my name is Brandy Hogue. I'm the Director of Team Member Services, and joining me from our Warrenton plant, I have in the room Hiram Cho, our Plant Manager, and Vidi Garcia, our bilingual QA Manager, both of which have been on the front lines at our operations, supporting our team and implementing our safety protocols. Tonight, I wanted to share with you what preventative measures Pacific Seafood has implemented in our operations, particularly at our Warrenton facility. As we've been working through this pandemic for months, we've partnered with state and local agencies to evolve our protocols and make sure we aren't just meeting, but exceeding all safety measures. As I hope this town hall shows, dealing with a global pandemic is a community effort. As a result, I wanted to thank the Oregon Health Authority and the county health offices across the state for all their assistance in supporting our safety efforts, providing expertise, and coordinating communications with local community members. Tonight, I'd like to focus on a couple key areas in particular: our workplace protective measures, our response when a positive case is identified, and our phased reopening of operations in Warrenton. Regarding protective measures, we are strictly following all safety protocols recommended by OHA and the county health officials, including face masks, physical distancing, gloves, protective smocks, and sanitation best practices. I also wanted to outline some additional steps we've implemented several months ago to further mitigate risk of exposure in the workplace. Providing face shields to be worn over masks. Every day performing daily health screenings and temperature checks of all of our workers and any visitors that come to our plant. Restricting those visitors to limit risk of exposure. We've hired additional sanitation workers that perform hourly sanitation in all common areas. We clean break rooms before and after breaks and at the end of every shift. We have set up physical dividers to ensure distancing on our plant floor and in all of our break rooms. And then we've also implemented cohorts. This means that we have separated our teams into small groups, keeping them on the same shifts and breaks with minimal to no crossover between departments. This has been critical in our safeguards. If we have a concern about exposure, this allows contact tracing to be immediate and very targeted to the cohort group, allowing for quarantining of a small group as opposed to an entire operation. We really care about our team members and this community that we've been a part of since 1983. We have always rallied around our team in tough times. After the devastating fire at our facility in 2013, we promised to keep our team employed and to rebuild. And with the help of many members of the community, including Senator Betsy Johnson, Commissioner Mark Cuela, and Mayor Henry Balanceifer, we kept that promise. And during this pandemic, we continue that promise to do everything we can to support our team and the community, keeping each other safe. Some details regarding this response. As soon as we discovered that some of our team members had been exposed to COVID-19 at a large Labor Day barbecue in the community, we quickly mobilized with the Oregon Health Authority to provide testing to that particular cohort group. After receiving the results of our September 22nd tests, we opted to test the remaining workers immediately to determine if we had workplace spread. The results of the second test group further validated that the outbreak could be traced back to Labor Day social activities, not to workplace exposure. The rapid COVID testing provided by Pacific allowed us to quickly respond, to get workers quarantined, and to provide others on our team and the community with the peace of mind that we were doing all we could. Whether our workers have tested positive or have been quarantined due to potential close contact, our team members are receiving food, supplies, and other support services that are being delivered by our staff and a great group of dedicated community organizations. We are also providing emergency paid leave for those in isolation and quarantine. We're in regular contact with our team members that are quarantining, and thankfully we can report that nobody has been hospitalized. Only a few have minor cold-like symptoms, and most are completely asymptomatic. What's currently planned at our Warrenton plant for operations? We suspended the operations on night shift following the first testing group, and all operations of our facility following the September 24th testing to further ensure the safety of our team members, allowing for extra sanitation measures and easier collaboration with agencies in contact tracing. We will be quickly approaching the end of our first testing group's quarantine periods, and will continue to work with OHA and the county to create a plan to safely return team members back to work in a phased reopening of our operation. We started that reopening process on Wednesday with a small day shift cohort group who all tested negative and were not exposed to the virus. We are anticipating being able to start a second phase this weekend to include another cohort group comprised of additional day shift and a modified night crew. We are committed to working closely with our community partners and health officials to protect our team and minimize community spread as best we can. We want to thank you for your support. We appreciate our team members and all the fishing families who count on us.
Great, thank you, Brandy. Now it's time for questions that you have. I imagine that they have been gathering up, but just as a reminder, if you have a question and you're on Zoom, please address your question to Ask a Question. If you're on by phone, you can email your question to, I just lost the link, orcovid19.jic@dhsoha.state.or.us. And with that, I'll ask the moderator to go ahead and pitch the first question.
Hello, everyone. We have about 15 questions so far. And the first one is, when there is an outbreak at a food processing facility, can the food itself become a source of COVID spread for people who eat it?
Dr. DeBest, can you answer that question?
Yeah, hi, thank you for the question. At this time, there's no indication that food itself could be a source of infection for COVID-19. There are multiple papers and published documents out there that actually discuss this particular aspect. The likelihood of that, the organism or the virus itself surviving anywhere is pretty minimal, including surfaces. Obviously, we're concerned about consuming some of the food. And as a reminder, we ask people to always wash their vegetables and fruit after they come from the supermarket, just not only because of COVID-19, but because of other pathogens that could potentially cause gastrointestinal disease.
Thank you. Next question.
Okay, next question. What steps are being taken to prevent the stigmatization of our Latinx community as a result of blaming that can result in threats and further discrimination? How are stereotypes being overcome so that the contributions of our workers are recognized?
I'm going to check and see if perhaps Monica or maybe Viviana or Susan want to tackle that question.
This is is Monica with Clatsop County, and from the public health perspective, as well as working with our community-based organizations such as CCA and the Hispanic Council, we are doing our best to educate people that anybody is susceptible to this virus. It doesn't matter what age, what gender, or what ethnicity you are. We're all susceptible to this, and so that's why we all need to be taking precautions. I know that there's a lot of questions and people wanting the county to identify who is the most recent cases, and because of these reasons, that unfortunately people are out there and stigmatizing these individuals. We're doing our best to follow HIPAA guidelines and protect them, and remind people that, again, anybody is susceptible. So I don't know if Viviana would like to add something to that.
No, I can totally identify. I'm half Japanese and half Hispanic, so I feel that question. And Monica, you're absolutely right. Education, and we've been doing the same thing as CCA, is educating about the disease and how it's spread as much as we know. Susan, do you want to add anything to that?
No, I think you guys actually covered it really well. The only other thing I could add to that would be to say that at Clatsop Community Action, we don't discriminate against anybody. So that's all that I have.
Great, thanks all of you. Next question, please.
This is a series that were all related, so we're putting into one question. Initially, all cases were asymptomatic, so how were they discovered? How many of those had serious symptoms or pre-existing conditions? How many were hospitalized, on respirator, et cetera?
Dr. DeBest, I think that's a question for you again.
Yeah, thank you for that question. So a number of cases were asymptomatic, and obviously there was a subset of individuals that were symptomatic as well. At this point, we don't have any more information other than we know that no one has been hospitalized and everybody seems to be recovering just fine. Reminding you that this is health protected information, and that we can only say only a few things and in very general terms about the health of the individuals.
Just want to emphasize a point Dr. DeBest made, which is I think the questioner, or the question was framed in terms of all the cases being asymptomatic, and that was not the case. There were symptomatic cases that led the public health response to be to do more widespread testing at the facility that turned up the large number of asymptomatic cases. Next question.
Can you describe the relationship, if any, between the Pacific Seafoods outbreak and today's decision to add Clatsop County to the state watch list?
Yeah, I can speak to that a little bit. The watch list is two things about the watch list. One is that we place counties on the watch list based on a metric that is related to the spread of coronavirus that can't be traced to another case. And once we get over a certain rate, then we make that choice. What being on the watch list means, though, really is we OHA provide additional resources and assistance to a county on the watch list to help them deal with those sporadic cases and to try to get that count back down. And that's exactly what we've been doing over the last week with Clatsop County in terms of providing case investigators, helping with testing, those kinds of things to provide those added resources and assistance. A county, once it's on the watch list, would stay on for at least 3 weeks, and then we would look at that case metric again and see. And so the question was whether it's related to this outbreak. The number of cases obviously went up with this outbreak, and so it's probably contributing, at least in some respect, to those sporadic cases. But the result is more assistance to the community, which would have occurred whether it was on the watch list or not.
Okay, next question. Was the Labor Day gathering a Pacific Seafood sponsored event? And how do we know that that's the source of the infection?
Well, I think Dr. DeBest mentioned in his presentation that we don't know that it was the source of the original outbreak. It was an event that occurred around the time of the original outbreak, and so it could be a source, but that's one of those questions we don't know in terms of the different kinds of ways the disease transmits: social gatherings, household spread, workplace spread, and those kinds of things. Brandy, do you want to speak to whether that was a company event or not?
Pat, I think we lost Pacific Seafood. I don't see anybody.
Okay, Dr. DeBest, do you know whether that was a company event or not? Amelia, are you there?
Okay, here I am, sorry, some difficulties. The Labor Day gathering was not part of Pacific Seafood effort to get people together. It actually happened at a different location provided by a different company.
Okay. Next question.
I think Brandy just joined us. Brandy, did you want to add anything to that previous question? Okay, we're going to move on then.
Sorry, I just joined back in, so I didn't even hear the question.
The question was whether the Labor Day event was a Pacific Seafood sponsored event.
No, it was not.
All right, next question. In light of false positives, will you be changing testing protocol using a lower cycle threshold as the NFL has done, for example?
Yeah, so false positive is really not quite the way to describe, I think, what the questioner is asking about. What the question is about is the question of whether someone who has coronavirus, the presence of coronavirus, has enough of it to be infective. This is an emerging discussion that's been out in the literature just in the last short weeks. We would look to Food and Drug Administration, which approves tests, for guidance on whether to change any of the protocols that they've currently approved on the tests that are being used out in the community right now.
Okay, how does this outbreak affect the school district, specifically in Warrenton, but others in Clatsop County offering some in-person learning for the younger grades?
Monica, do you want to take that one, or do you want me to try?
I would prefer that you try, simply because it's my understanding that there's certain metrics Warrenton chose to shut down, and so the possibility for them to reopen is there, but other school districts would have to wait. But I'm going to leave it to you.
Sure, I'll take a shot. And I don't know the specifics of Warrenton exactly, but I can tell you that there are several ways that schools can open. If they are not already open, there are rates of cases in a community, 30 per 100,000 for K through 3 and 10 per 100,000 for grades 4 through 12, and that has to be sustained over a period of 3 weeks, and no more than 5% of tests being positive. That's all a little bit complicated. But this outbreak could affect, and certainly has affected, those metrics, and Clatsop County would not be within those metrics. There are some exceptions for limited in-person education in districts that, as long as there aren't cases in the school population of students and staff, they can do small cohorts of students. Also, if a district has in fact opened using one of those earlier metrics I talked about, then cases in the county wouldn't roll them back to be closed. It would be based on outbreaks within the school district or within the school itself that would cause that to roll back. I don't know the circumstances of what's going on in Warrenton to know which of those kinds of categories it falls into, but I guess the answer is there are some school circumstances that would be impacted by this and some that would not necessarily be.
All right, next question. These are questions I'm going to combine. They're related to seasonal and farm workers with H-2A or H-2B visas, specifically asking if individuals must be in quarantine, what lodging and accommodations like food and laundry do they have to assure that they're able to do that? And the second question is, has there been any thought given to testing domestic farm workers and H-2A farm workers around the state proactively?
For the first part of that question, Viviana or Susan, would you be the right ones to answer that?
Actually, for the Pacific Seafood workers, the laundry was done by Pacific Seafood. So
okay.
Brandy, do you want to take that on?
Sorry, I had to wait to be unmuted. Yes, we are providing all services so that they can 100% stay quarantined. And we also have support staff that we keep on site both on day and night shift at various workplace housing areas. And then back to the additional quarantining, we do testing before workers come when they arrive in the visa program, and we stage them in quarantine before they ever go to local communities where they're going to work. So there's extra precautions even on the front end to ensure that they are safe and healthy before they arrive into local communities.
And then I would just add to that, if people need to quarantine or isolate who are not employees at Pacific Seafood, they can get assistance with those supports for quarantine through Clatsop Community Action Team. Also, there is a COVID-19 paid leave program available for people who need to quarantine and isolate that provides income replacement, and there's a website for that that can be accessed, www.oregon.gov/COVID paid leave, COVID PAID LEAVE.
Have there been any plans made to proactively test employees at other Pacific Seafood facilities, since some of those facilities may share staff?
I'm going to look to either Emilio or potentially Monica for that. Monica.
I guess I didn't understand the question entirely. Are you referring to other processing plants, not other Pacific Seafood locations?
The question was specifically about.
So in regards to that, we are working with other Pacific or other processing plant locations in regards to when there are potential cases and doing testing. So the county is providing those services for those processing plants because there is the concern that there are employees who work at multiple locations or reside with employees that work amongst the different locations.
And that reminded me that I forgot to answer the second part of the other question having to do with proactive testing of farm workers or other agricultural workers. And the White House earlier this week announced a large new supply of tests that in fact will allow us to expand that kind of proactive testing. The challenge will always be that testing people who don't have symptoms or don't have symptoms yet is much more challenging than testing people who do have symptoms, but we do expect to expand that testing. Next question.
What steps are being taken proactively in worker housing, cafeteria, and transportation to and from work to protect workers?
Brandy, you want to take that one?
Yes, so we have a seasonal housing safety protocol that we've established. Those that are living together in outside housing, particularly seasonal workers, we provide hand sanitizer and cleaning so that they can take care of some of that on their own and their living situation. We also have fogging and demister sanitation, additional tools to do some sanitation. We also, if we're transporting, our vans are large enough, we do it in small groups, everybody wears masks. We do cleaning before and after, shuttling any team workers to facilities. Does that, I think that answers.
Yep, I think so.
A couple of questions related to wearing masks. First question, if masks are mandated, how did this happen? Second question, I can't wear a mask or a face shield. What can I do?
Well, so to the first question of if masks are mandated, how did this happen? Masks being mandated doesn't always mean masks are being worn, first. Second, masks are extremely helpful. They're not perfect. And so there continue to be risks even with masks. They're much lower with masks. And so we would continue to ask people to wear masks indoors and outdoors when they can't maintain social distancing. If an individual is one of those rare people who really has a medical condition that prevents mask wearing, businesses are not required to allow you into the business, but they are required to attempt to accommodate you. So think of a grocery store where if you've got a condition where you can't wear a mask, you don't necessarily get to go in, but the store can do curbside delivery or online delivery or those kinds of things. And so the obligation is to accommodate the individual's need.
Have other large employers like Costco, Fred Meyer, Walmart been approached and tests offered to ensure the outbreak is not larger than reported or that the outbreak at Pacific Seafood is an anomaly?
I need to look to either Monica or Dr. DeBest to talk about testing plans in the community right now.
So from the county public health perspective, we continue to provide testing opportunities to the general public twice a week. In regards to those who are symptomatic, if they aren't able to go to their own provider, we also have those services available to them more regularly outside of just the twice a week if there's an immediate need for it. If there is a workplace outbreak, we have been working with those different businesses. There are certain guidelines in regards to the number of employees that qualifies notifying the public as to whether or not it's an outbreak. So at this point in time, I believe if you are a certain size employer, you have to have had more than 5 employees before we notify the public as to what business that is.
The other thing I would add is that Astoria is participating in the sewage system monitoring program operated by Oregon State, which is a kind of an early warning system that would alert us to a growing outbreak in the community. And I think they went online with that about a week ago. And Monica, I don't know, I can't remember if Astoria and Warrenton share a system. I know the plants, I think
they're two separate systems, and to my knowledge, it's just Astoria that's participating in that.
But if there's a widespread increase, then the monitoring in Astoria would give us a pretty good idea of what's going on elsewhere in the region.
Yes.
Shifting from large business to small business, how can small businesses get access to rapid tests for employees who believe that they may have been exposed to someone who tested positive? They're asking about a specific employee who had to wait for results and wait to get in. Is there any way we could have accessed a quick test?
Monica, you want to tackle that?
Sure. So the county has been trying to access equipment to be able to facilitate the rapid testing. Unfortunately, the availability of that equipment is not immediate because there is such a high demand for it. We are in the process of leasing that equipment, and hopefully we'll have it up and operating soon. I do know that the hospitals have these machines that can offer this, but again, it's kind of dependent on the provider and being able to get in to see the hospitals. But it is within our community, and we're working on increasing the availability of it.
Is the housing for the workers who have contracted COVID arranged by the employers?
Yes, it is. Brandy, do you want to talk a little bit about that?
Yeah, we work with the local community, and we have partners to secure housing. It isn't managed by Pacific Seafood, but we partner with the community with various housing from apartments to hotels and others.
Are there plans for retesting the workers now at regular intervals once the plant is open?
Generally not. That's called serial testing. Serial testing of people who don't have symptoms of disease is not something that's well supported by data as something that's useful. And so we would continue to basically try to approach this from an outbreak standpoint, which is identify people who have coronavirus, test their close contacts. We are changing our testing guidance that those contacts to be tested now don't need to be symptomatic. They can be asymptomatic contacts, but we think that that case-based testing continues to be a more effective way to find and successfully isolate and quarantine cases.
What will be the process for bringing workers that tested positive back after their quarantine period?
I'm not sure what process would mean. Dr. DeBest, can you talk about at what point someone who has tested positive is able to come out of isolation?
Yes, and thank you for the question. It is important to remind people that there are two terms that we need to talk about. One of them is isolation and the other one is quarantine. Isolation is when somebody tests positive, that individual goes into isolation for 10 days. Quarantine is for 14 days and are individuals that have had an exposure to a positive individual. So at the end of the 10 days, isolation is over for those that have tested positive and they can go back to work without any issue. The studies have shown that people after 10 days are not shedding live virus that could actually create or cause an infection to anyone else.
Great, thank you. I see that Tom Rogozinski from Warrenton Schools is on the call and is able to speak to the Warrenton Schools circumstance. Can we unmute him so he can speak to that?
I will go ahead and do that in one moment.
All right, thanks, Patrick. So Tom Rogozinski here, Warrenton Hammond, Superintendent of Schools. Just to speak to the specifics of our situation last week in light of the outbreak, certainly our choice to close schools last week was in light of the number of cases right in our community, and it really would be that decision would be made as rapidly as it was like we made it with the input of Clatsop County Public Health and just the uncertainty around those cases and not knowing they weren't fully contact traced. Was there a likelihood or a chance that those folks, any of those employees' kids were in our district, and would we be exacerbating the spread by keeping our schools open? So there was an immediate decision made to close schools because of that. That's separate, however, from the longer term closure that we were faced with subsequently. And that longer term closure is related to, as Director Allen cited, the metrics that the state have for schools opening and closing. So the metric that we were open under, our schools were open for 2 weeks. The metric that we needed to keep the schools open was, there's really 3 of them, but the one that was pressing us was no more than 30 COVID cases per 100,000 in our county for 2 weeks in a row. And sort of concurrently, the second week that we exceeded 30, was last week. And so it is that metric now that is keeping us closed per the ODE and OHA guidelines for the next 3 weeks. And we'll be monitoring those, the metrics locally. It's still fully our intent to bring students back for in-person instruction as soon as we can. And as Director Allen alluded to, even if those metrics are not met in the coming weeks, we have opportunity for limited in-person instruction to occur in certain circumstances, and we expect to fully exercise that as well. So yeah, Director Allen certainly nailed all those options. And for us, the initial closure was related to the immediacy of our community outbreak. The long-term closure is related to the metrics that were exceeded.
Thanks very much for that, Tom. We are at 6 o'clock, but I also know there are quite a few questions in the queue, so I think we're going to keep going for a bit. It will be impossible for us to get to every single question, and so again, we'll post contact information that you can reach out and provide questions, and we'll find a consolidated site to be able to put those questions up so that everyone can see the answers. Let's go on to the next question.
What's the likelihood of Clatsop County being moved back in its phase of reopening, or for various industries seeing increased restrictions or worksite closures?
Based on what we know today, I think the likelihood of that is low. There are only a couple of circumstances in the state where we've moved the county back a phase, and those were in circumstances where the rate of cases per 100,000 were not at that 10 or 30 we talked about for opening schools, but at 300 or 400 cases. I don't today see signs that that we're remotely close to that kind of a circumstance in Clatsop County. Obviously, things could change, and there could be a circumstance here, or really in any county where there's widespread transmission of coronavirus, that decision could come, but it's not something that's actively being considered right now.
What kind of support and training is being given to workers who may speak languages other than English or Spanish?
Brandy, is that you?
Yeah, so we have a lot of our safety programs translated in written programs translated. We also provide on-site. We have translators in all of our shifts. We do shift meetings where we're continuously doing on pre-shift safety trainings along those lines. So we have continued all along to continue talking about our safety programs, training our lead supervisors and managers, and really bringing home our workplace safety, the 6 feet social distancing, masks, both in work, but then also when you're outside of work and in the public.
And I would just add that at OHA, we translate most of our educational and other materials into typically the 11 most commonly spoken languages. Translated materials don't always help, as there are languages spoken that are not written languages, but that's a step we try to take to help with that as well. Next question.
And Patrick, if I could just add that the Clatsop County Public Health Department is also doing our education in both English and Spanish.
Great, thank you. Next question.
Why did OHA supersede Clatsop County with Pacific Seafood, but not with other plant outbreaks?
Sure, I'll tackle that. I wouldn't say that we superseded Clatsop County. I think early on, when this outbreak became evident, there was some coordination around who would be responsible for what. I talked about whether it's related to the outbreak or related to being on the watch list. Part of what happens is providing extra help, and my understanding is the decision was made that we would handle case investigation and contact tracing for night shift cases, leaving Clatsop County's resources free to work with day shift or other cases. And quite honestly, as the pandemic has progressed, and as we go through each experience in different places, we learn more about what's an effective response and what kinds of things we need to do. And so there are things that we do today that we didn't think to do or didn't have the resources to do previously. And we We hope that we're all collectively at the state and local level getting better at this, and responding more nimbly and more effectively. Monica, do you want to add anything to that?
I just think it goes back to those community partnerships and being able to have resources available for all of us to work together.
Next question.
What kind of protections are in place at the plant? Are there barriers, shields, and can you make photos of these protections available to the public?
Brandy.
Yes, as I talked about in my statement, we do have numerous safety protocols and measures put in place, including what you mentioned, which is the physical dividers throughout the plant and in the break room. We have provided that. We've had ODA, Oregon Department of Agriculture, Oregon OSHA, the County Health Department, OHA at our facility doing walkthroughs and seeing all the different things and getting recommendations from them as to what we can do to even exceed the requirements. We're happy to provide some of those things and our workplace safety protocols. We're proud of the work we've done in our plant, and we'll get that so that people can see it.
Have any OSHA complaints been filed since June? If so, did Pacific Seafood take any steps to address the workers' concerns, even in cases in which OSHA dismissed the complaint?
Michael Wood from Oregon OSHA is with us, and I would ask if he could answer that question.
So we have received complaints related to Pacific Seafood over the course of the COVID events, really since the 1st of March when we began tracking them separately. We've only received one complaint about the Warrenton facility, and that was actually in May. We have not received any complaints about that facility since then. And I guess I should say that in that case, the issue was the suggestion that people were being required to return after testing positive. We verified in discussions both with Pacific Seafood and supported by local health that that did not appear to be happening. And we couldn't loop back to the complainant to discuss it further because they were anonymous. And so in that sense, they were not only confidential, but they were actually unknown to us.
Great, thank you. Couple more questions.
Sorry, we're still scrolling through. Just hold for just a minute, please.
Okay.
Were there any other positive cases in the community? If so, how many?
Dr. DeBest, do you happen to have those numbers at your fingertips?
I do not, but I like to say that the County Health Department has a website in which they actually post their cases on a regular basis. So please go to the County Health Department's website. There have been a handful of cases related to COVID-19, not necessarily related to Pacific Seafood. As I mentioned before, this is a community infection, so it's a community-acquired infection. Thank you.
Monica, do you have any particular numbers you want to add to that, or?
I apologize because we have had numbers come in, but I'm not entirely certain where we're at this point in time. I will say that we do notify on a regular basis through our class-up alerts system how many cases have been shown positive for the day. And in an instance such as today, we had 3 additional positive cases, and those were traced back to the Pacific Coast spread. And so when that has happened, we have identified whether or not it was through that method or whether it was through other community spread, which is also happening.
All right, let's take one last question.
Why are more details not included when the county releases updated case reports? For example, the number or percent of positives who are asymptomatic and the degree of symptoms from mild to more severe.
Monica, do you want to speak to that?
Sure, I will. So we operate under HIPAA guidelines, and so when we are notifying whether or not the case is positive, and we also have regularly stated whether or not you know, if somebody is convalescing at home or if they've been hospitalized. But we are trying to be respectful and operating under those HIPAA guidelines. And so ultimately that's what drives how we operate.
All right, that concludes our town hall tonight. I believe we're going to put contact information on the screen now. Do I understand that correctly? And there is contact information for everybody you've heard from tonight and a few people that you haven't. This is staff from the Health Authority, from Clatsop County, from the Community Action Team, contacts for Pacific Seafood, the State Department of Agriculture, Oregon OSHA, State Department of Human Services, the Employment Department, the Office of Workforce Investments. If you've got questions and that you want to send to any or all of those people, please do that. We'll gather those questions and answers and post them so you can see them later. We'll leave this up for a little bit, but it'll also be on the recorded version of this session on OHA's YouTube channel, as will this entire presentation. I want to thank everybody who took time to listen in, ask questions, and for all the people who've provided information tonight. Thanks, and that concludes our presentation.